Good evening for everyone who's been able to join us this evening. You are here with us tonight to learn a little bit about navigating financial and insurance issues. This should be an enlightening topic for everyone. Again, this is brought to you by the Dilated Cardiomyopathy Foundation and the Mended Hearts, working together to educate and support patients and families. We're going to give just another few seconds here to let other people join, depending on where they are around the country. It may be the dinner hour or just afterwards. But again, for additional information, you can always go to the DCM website at dcmfoundation.org. And so why don't we get rolling? Let's go on to the next slide, and we'll just cover some basic housekeeping items while other people are joining. As always, all attendees are muted so that we can hear the speakers in tonight's presentation. Everyone is in listen-only mode. If you cannot hear for some reason, first, please check your audio button to be sure your sound is actually on. Please enter any questions you may have during the presentation into the Q&A box at the bottom of your screen, and we will address these at the end of the presentation. We're going to leave a good period of time for Q&A at the end. We're sure a lot of people have questions. And a copy of the slide deck, as well as any of the links we talk about during tonight's event, will also be emailed to all registrants following tonight's presentation. So the DCM Foundation, for those of you who may not know, was founded in 2017 with a mission to provide hope and support to families and patients with dilated cardiomyopathy through research, advocacy, and education. And the Mended Hearts organization is a national and community-based nonprofit organization offering the gift of hope to heart disease patients, their families, and caregivers. MHI is the largest cardiovascular support organization in the world, and we're thrilled to have them on tonight's webinar as our partner with us. Next slide. Tonight's presenters, we have Jody Smith with us, the National Program Director of the Mended Hearts and parent of a heart patient. Jody is National Program Director with Mended Hearts, a 70,000 plus member program for patients, parents, caregivers, and families affected by all types of cardiovascular disease. She is a strategic program and training director with years of experience developing and implementing programs for patients and family advocates. Jody has 3 sons, one of whom was diagnosed with a congenital heart defect before birth. She's therefore very familiar with the financial and insurance aspects of staying in care. And those of you who've been on our webinars before may be familiar with Greg Ruff. He is president of the Dcm Foundation and a DCM patient as well. In 2014, Greg was diagnosed with DCM with an extremely weakened heart muscle and conduction system disease requiring a pacemaker. Through genetic testing, it was revealed that he had 3 mutations, 2 in the lamin A gene and 1 in the TPM1 gene, which were responsible for his DCM. 9 of Greg's family members have been identified with gene mutations known to cause DCM. Greg lives in Dublin, Ohio with his wife, Brenda, of over 30 years, and together they have 3 grown children and 2 grandchildren. Actually, side note, and Greg will tell you, Greg is joining us from a hospital room this evening, which we'll talk about in just a minute. First, we're going to put up the first poll tonight and just get an idea of who is joining us this evening. We ask that you just select which best describes why you're participating. Are you a patient, a family member, a medical provider, or interested for another reason? Just take a quick moment to click whichever applies. And I'm going to share the results. Great, looks like we have a lot of patients with us tonight. 75% are patients, and we have some representation of family members and medical providers as well. Excellent. So without further ado, let's continue on, and I would like to present to you Greg Roof.
Thanks, Jan. Next slide, please. Great. Again, as Jan said, I apologize for the background or any background noise you might hear. I am at OSU Heart Hospital in Columbus, Ohio, dealing personally with navigating financial insurance issues with cardiomyopathy. So the timing, you look at it as it's great or it's bad, but it's good to be here this evening. Tonight's webinar, we're really not going to discuss what's wrong with our healthcare system. You know, as I have been with the foundation, I've been a patient, I've been a business person. Every person I've ever talked to, patients, families, people in insurance, health insurance, people in medical providers, certainly biopharma, everybody has their complaints. We have sort of a strapped together system that has a lot of moving parts and probably a lot of holes. So we know that, and so we're not advocating that it's a great system, it's a horrible system, but it's our system and it could be improved. But what we will do, so tonight we're just going to talk about how to navigate. Joe and I are going to talk about how to navigate through the current system. And again, this is our, sort of experiences and opinions. What we're going to show you throughout the presentation, and then after this evening's presentation, we will send you links where there are truly, expert articles and links and resources for you. So we hope to be helpful tonight, but this is more a little bit of our personal experience, our personal view, and our personal thoughts. I know that Mended Hearts works pretty heavily in advocacy, patient advocacy, and that's something that certainly Dcm Foundation will be doing in the future years. Jan? Next slide, please. So first of all, I want to talk about sort of tips and ideas. What are some tips that we can personally give you, and some of the things that we've done to sort of navigate this area. One is we'll talk about setting yourself up for success. Next is creating a self-advocacy mindset and then putting that into practice. Third area that we'll discuss is how to work with health insurance companies, dealing with hospitals and medical practices, certainly managing prescription drug costs. And as I mentioned before, we'll have resources at the end of tonight. And when we send out the recording, we'll have also have a document that has a bunch of links for advocacy resources. Next slide, please. So we look at the first topic, which is setting yourself up for future success. You know, we are where we are. I have the health insurance I have the coverage, I have the out-of-pocket, whatever. And as most of us do, and we have to deal with this. We're here, we have to live with it. We have to try to thrive and survive in it. But one of the things I want to talk about before you get to your current plan, how do you set yourself up for the best success to make sure that you're doing the right things to get a good plan and to minimize your expenses. So one thing to need to think about, of course, if you're changing employers, if you have a heart, chronic illness, cardiomyopathy, whatever it may be, one of the things you have to be really, really careful of is, of course, your health insurance plan, because there will be heavy costs, there will be potentially catastrophic costs. So when you're changing employers, one of the things that we really suggest is you really have to look at, most people look at salary, they look at hours, things like that, but 401k. But one of the things we think you really, really, really need to be probably number one on your list is looking at their health insurance plan, what it covers, what it doesn't cover. And having a chronic expensive illness, how are you going to be able to afford that and be reimbursed? Also, if you have a job and employers, as I think someone had said, employers change policies every couple of years, it seems like. You want to make sure that you get with your human resource benefits person whenever they're thinking about changing plans. You really want to understand those plans and understand how those changes will affect you, and do whatever you can for advocate for yourself or to lobby for your rights. One thing that just came to my attention this year, I didn't realize this existed. I don't know how prevalent it is, but I had a family member that sort of retired early, and they wanted to pick up self-insurance before they started on Medicare. And where they live, nobody will write individual. There's not one insurance company that will write individual policies. So they, that's horrible. So, and one of the things, if you're looking at moving, before you move, make sure that the area you're moving, if you need to get a personal plan, that their companies will write decent plans for a decent price. So be careful of that. Last one is COBRA, but it's also, the healthcare.gov. Understand when you're changing employers, you become unemployed, exactly what are the inner workings of COBRA, what do they cost, what are your rights, how long, and then look for potential other options like Medicare.gov or personal insurance. But again, it's always best if you can certainly find another job with a company that can actually, or a government agency or whomever you're working for that has good health insurance. Next slide, please. The second area that I really want to talk about is, again, also sort of setting things up. We talked about setting yourself up properly, and this is sort of, I think, setting yourself properly with your current insurance, your current programs providers. Really, you've got to create a self-advocacy mindset and put that into practice. And one of the things I want to bring up front are we're all different. I'm a guy that doesn't mind arguing, and I kind of enjoy it. And if everybody knows me, they know that that's true. So I don't mind being a self-advocate for myself and going to bat for myself when I think that, I have been wronged in a medical cost or health insurance coverage or whatever. But so make sure, create a self-advocacy mindset for yourself. But if you're a person that really doesn't like conflict, doesn't like, getting into these types of things, find a family member or a friend that you think could be a very good advocate for you. So make sure that you go in with advocacy, and that could be with a family friend or self-advocacy. Remember, because every provider can be your friend or foe. It's a little negative. We looked at the wording and say, how do we say it not be negative? But the reality is you need your medical providers, you need your medications, you need your health insurance, but there are situations, and they're your friends, there are situations that you have to speak up for your rights. And again, there are times that you're going to have to fight for your financial rights. One of the things that I also would do is make friends in all areas of your healthcare, whether it's medical provider, health insurance, pharma, biopharma, drug costs, get contacted and create a relationship. All of these organizations have patient advocacy representatives. So before something goes wrong, you should call these people up, make friends. They should know who you are. They should understand your situation, go from there. And then again, it's all about learning to work the system. I don't mean that in a negative way, but we have at times a convoluted healthcare system. So you need to be able to work the healthcare system to your benefit. Next slide, please.
I'm going to take just a quick second, Greg, and I'm just going to put up the next poll. Whoops, if this will. Do you feel you can properly advocate for yourself or your family member when it comes to medical insurance billing? And the options are, I actively advocate for myself as a patient. I do not feel comfortable advocating for myself as a patient. I actively advocate for my family members, or I do not feel comfortable advocating for my family members. And this is multiple choice because we realized that oftentimes people are more comfortable advocating for a family member than they are for themselves. So this will be a little bit interesting. We'll just take another quick minute here. We've got most of the results in, and I'm going to end the polling and share the results. And this is interesting. So 57% say I actively advocate for myself as a patient. So that's good. That's just more than half. I do not feel comfortable advocating for myself, 30%. And that's where you probably do want to bring in a family member or someone else who can assist you in those discussions. I actively advocate for my family members. And again, we find that that's pretty common. People are more comfortable advocating for others. I do not feel comfortable advocating for my family members. And that's an interesting answer as well. So thank you for that. We'll stop sharing the results and we will move on to the next slide.
Thank you. So slide 9, how to work with insurance companies. Again, as I just mentioned, create a relationship with someone in customer. Right when you get a plan or a new plan, they've got customer service representatives, patient advocates. Again, before you get a huge bill and they say they're not going to cover it, or there are issues, and there's all sorts of back and forth, make sure that you have an internal patient advocate, that somebody. It makes it so much easier. So again, it's trying to be, some preventive measures. Also, I mean, they've got services that can also be very helpful for you on all occasions, just not, financial issues. Also, make sure that you call and check on approval before all medical services are incurred, especially the expensive ones. Now, their medical provider, healthcare provider tends to do that, but you also can reach out and say, hey, I'm going in Monday. I just want to make sure you got this cleared. There have been occasions where they said, no, it hasn't. We haven't heard from them. Then you go back into your representative that you have as a medical provider that you've, again, created a relationship with, and say, hey, here's an issue. And I'm not sure I really want to get this procedure or potentially incur this expense until we got everything worked out. Third thing is, you will get denials if you have a chronic illness and you're getting a lot of tests and a lot of procedures. You will get denials. Don't get excited. I used to, and again, given I've got dilated cardiomyopathy and heart failure, and probably would have been smart in the beginning for me not to get excited and just realize that that's going to happen. But that's, in most instances, I have found that even when you get a denial at first, it's a coding issue. It's something that the medical provider and the insurance company will work out. And so, let that dance go on and then see where it falls out on the back end. Other thing is, if you have the opportunity, try to sign up for a health savings account, an HSA. Lots of times employers will have that, or you can get these programs on your own. If an employer provides it, they would tend to have lots of times a match, a copay or something where they'll actually contribute to it. It's all tax-free dollars up front. And then you also can contribute your own money, which is tax-free. So if you're getting 25% of your pay taken out in taxes, if you sign up for an HSA, every dollar you put in, you save 25 cents. So that's really important. Investigate those. See what's out there, either with your employer and or in the marketplace. And you can get those on your own. HRAs, which are health reimbursement arrangement. A number of employers have this. You can't get these on your own, but it's through your employer. For instance, my wife, we're under her health insurance now. We have a 6880 max out-of-pocket expense individuals, as a lot of the plans have gone, sort of higher max out-of-pocket. But her company has a plan where they actually pay $4,000 of that. So something that's quite unmanageable becomes very manageable on an annual basis. So check that out. That can be really, really helpful. Jody?
So when I talk about insurance, one of the things is that you need to know is most of the things I have learned about insurance, I did learn the hard way. So when we first got insurance for my family and myself, I was younger, I was healthy. I had 2 healthy kids at the time, and I didn't really care what my policy, I mean, I cared what my policy said, but basically I wasn't using insurance a lot. I would go to the doctor, pay my copay. It was very minor at that point. My out of pocket caps were not that large or anything like that. But then my third son was diagnosed with a severe heart defect at a 20-week ultrasound, and everything changed after that. So when he was diagnosed, we started looking at hospitals. There are only 125 hospitals that can do surgery on children with heart defects. So you're very limited in the first place. And then because of his combination of conditions, the chances of survival were very low. And so I wanted to take him somewhere where he had the best chance of survival, which was in another state. And the local people they had lost children with his combination of defects. And so I got permission from my insurance company to go, called a letter of necessity to go out of state. And I thought everything was fine because, again, I didn't have experience with this in the past. And I thought, well, okay, they sent me this nice letter that said, at this time in your life, the last thing you want to worry about is health insurance. It's going to be treated as if it were a network. Well, so that's when you really learn about health insurance and everything about health insurance, because my son had his first open heart surgery the day he was born. We were in the hospital 2 months. By the time we got home, we were in collections for medical bills. And as Greg said, when he talks about denials, we had many claims that were denied. He needed 2 x-rays a day, and the insurance company routinely denied the second x-ray at $700 a pop every day. And that wasn't worked out between the doc and the insurance company. So that was something we had to proactively, as Greg said, be a very strong advocate. So when you're looking at insurance, the things you really have to look at are what kind of insurances are available to you. Greg was talking about the individual market in Richmond, Virginia. Only one company is in the individual market, and that doesn't cover any of my son's doctors. So you have to become aware of that. I had to look up the doctors myself. I had to do the research myself. And so you just really need to pay attention to your plan. You look at the out-of-pocket caps. Some plans cost less, but the out-of-pocket is incredibly high. And so you just really need to look at that. Also, right now on the market are associated health plans. And so you have to be careful. If you buy into associated health plan, they won't cover any pre-existing conditions. So you have to be really, really careful about pre-existing condition coverage. They're not governed by the same rules as regular insurance. And when you get insurance, the things you have to really know about your insurance is information. Most of it can be found on your insurance card, and it is the copays. You can find out how much you'll pay for your primary care providers, for specialists, or on your insurance card. Phone numbers. So you have the phone number, who to call, the customer service. When Greg was saying call your insurance company, that's who you call. You get to know them. If you have something coming up, you call them. That's the number you call. They're there for you to support you. And so you get that. You make sure, as Greg said, things are covered in advance. You make sure you know what you're going to owe. I've had 2 situations lately where the healthcare provider said a certain amount was going to be covered. And then I get this big bill after it. And they're like, oh, we were wrong about that. Lesson learned. Now I find out how much is covered and ahead of time. Your ID numbers are on your insurance card and your type of insurance. So Greg was talking about like an HMO, or there's a PPO, there's a POS. There are different types of plans. And for an HMO plan, for a lot of plans, you have to get a referral before you can get care. And so you need to know what type of plan you have. Also, when you're about to get a procedure or something done, they will ask you often, well, what type of coverage do you have? And if you have a PPO or a point of service plan, a lot of times you can go a lot more places. My work now, I'm on a work coverage. I'm no longer on individual coverage. My work is in Georgia. I live in Virginia, so I have to have a plan that's a PPO because I can't have Georgia insurance and use it and have an HMO. You also have to know what is in network and out of network. So when it can be surprising sometimes because, for example, Joshua, the hospital that my son had surgery was in network. Some of the people, like the radiologist, was in network. The other providers were out of network. And so you have to pay careful attention to in network and out of network providers. It'll make a big difference in your bills if someone's in network versus out of network. So check with your insurance company, make sure all of the providers that are going to be treating are in network. If they are all not in network, come to an agreement. And there is a way to talk to them and come to an agreement. This is what you'll owe with the healthcare providers. The other thing is you may need a letter from your doctor. So like the letter of necessity we got. The other things you need to know is what you're going to owe. So your deductible, what you have to know about a deductible is you pay your deductible before insurance kicks in at all. Okay. So you need to know you're going to owe your deductible, whatever that is. And then you also need to, again, know whether referrals are needed, out-of-pocket limits. And also, it was surprising to me with my son. I didn't know this again because I didn't need a bunch of medication. But what we found out when we got home is the prescription plan cap, the max, is different than the major medical. So all the procedures that you would have are major medical, but you can have a prescription plan where the maximum on that, like his prescription plan cap was $5,000. Well, that if you are on expensive medication, as we were, it's not even going to get you through a year of medication. And so you just have to become very aware of what your prescription plan cap is, because that can come back and bite you. Even one of the injections he needed was $1,400 a month. So we maxed out of it. We had to pay the rest out of pocket because we maxed out on our prescription plan. So pay careful attention to that. So next slide. Okay, so then an explanation of benefits. I wrote it out because I always say don't use acronyms when you're speaking. And this is something that you get from the insurance company when you seek medical care. And now this might be online now. A lot of people are getting it online, but this is where you find out like that $700 x-ray was denied the second time. You can look on it, you can see what was denied, you can see what was covered. There are places to find out more about your explanation of benefits and what it says. But the bottom line is it tells you what the cost is, what the insurance covered, and what you may owe. Now, like Greg said, that may not be ultimately what you owe. They may like have a coding issue. They may fix some things, and it may not be ultimately what you owe, but it's what you may owe, what you may end up paying for the bill. But it spells it all out for you. That way you can look and see if something is denied. You can see, well, why was that denied? What was going on? And then if you don't agree, you can appeal it. So on every explanation of benefits is this whole back page. You get the third page and it has how to appeal it. And you can go through the appeals process. Honestly, if you don't agree with it, or if you're getting charged stuff and it was denied, I'd appeal it, because it doesn't hurt you to appeal it. But what it does, they're not going to cover it at all if you don't appeal it. And it's not a bill. So the explanation of benefits is different from your bill. You'll get your bills in the mail or online too. But the bill is something you're responsible for. Explanation of benefits just tries to explain your coverage. And then one of the things I was really shocked about with my son is, and I've had to have surgery on my hand and different things lately, is that you get bills from all these different places. So sometimes you don't. Like, some people manage it so they get one bill and it's for everything. And in some states and some hospitals, they do that. But in every place I've been to in Pennsylvania and Virginia, I got a bill from the anesthesiologist and the radiologist and the surgeon and critical care and the hospital. And so we got, in dermatology, I mean, we got bills from every single place. And sometimes that can be very confusing because you think, oh, I paid that bill already. And no, it's from the same hospital, but it's a different bill, source of billing. So when you do that, the best thing to do, I find, is get a binder, or do it online if you're better online. Get a binder, keep track of the different people who are billing you, and make sure you know what you paid on each one of them. And honestly, I hate to say this, but my first thought was, I pay the surgeon. He's got to have 2 more surgeries. So I paid the surgeon, and that's the first person we paid. And then just be careful. There's a new law out, the No Surprises Act, that should do a lot of remedies for surprise medical bills. But sometimes when you have an out-of-network provider, you can get a surprise bill from someone that you weren't expecting. So just be aware of that. That goes into effect January 1st, 2022.
Great. Thank you. Also, I want to add, thanks a lot, Jody. That was really, really helpful. I want to also add that we've got a few questions teed up for the end. We're definitely going to have quite a bit of time left for Q&A. So if you have any questions, just write them in. Jan, would you prefer the chat or the Q&A?
The Q&A, I can sort them out.
Okay.
Either, but the Q&A would be great.
Great. So if you have any questions so far, or as we go along before we end, that would be great. And then Jan can look at them, sort them out, and ask. So next topic, dealing with hospitals and medical providers. Again, this is sort of my opinion. This is my experience. What I have found it really easy to do is I create a relationship with one provider if possible. That's not possible in Jody because the help that her son needs is out of state. And so it's really difficult for her to do this. I'm very lucky. I live in Columbus, Ohio, and have a couple great hospital systems. I'm actually working with Ohio State, and I've tried to put absolutely all my docs, everything in Ohio State network, because I actually get, for everything I get one bill. Ohio State has done a great job in creating a relationship with United Healthcare, which is my health insurance company. So I get very few denials now. That didn't necessarily happen 5 years ago. And it's also great if you have a chronic illness, it's important that your GP understands what your cardiologist, which understands your endocrinologist, or whomever you're working with. They can go into one system and know what's going on and talk to each other. I think you also want to forge a relationship with, as I mentioned before, with the financial assistance group at your provider. I think all large medical practices, all hospital systems have departments that they're there to help you navigate. Again, they work for the provider, so you remember that, but they will help you navigate the financial system. If you need payment plans, if you've been denied and think you've been wronged, if you think you've been overbilled, they're there to help you. And you definitely want to seek them out, as I mentioned, very early in the relationship. And you also, and this is Greg's opinion. I know Jody had issues where before she got from the hospital, they're already in collections. But what I always try to do, and again, Ohio State and United Healthcare do a great job of this, is I almost never get a bill until Ohio State and United Healthcare has done their dance and decided who pays for what. So I may not get a bill from a service provider 30, 60, 90 days later, but I'm 98, 99% sure that bill has already been negotiated, discussed, and bounced back and forth, which is really helpful and creates less denials, creates, less bills coming in from all different directions. So those are been very helpful. Next slide, please. So managing prescription drug costs, again, I think Jody's mentioned quite a bit about this, but upfront, exactly what she said, know your coverage well. It's really, really important that whenever you go in, you're looking for a new job, you're looking for a new plan, you really need to research it and know your plan inside and out. It takes a little bit of time. One of the problems with being chronically ill is you don't have the energy to really work. So it's hard to keep insurance and to earn money to pay for your medical bills or pay for your health insurance. And the other thing is then, it is a part-time job dealing with the healthcare costs, very difficult. So one of the other things that you want to do from a pharmacy standpoint or drug cost is create a relationship with your pharmacist, whether it's the pharmacist down the street in a building or whether it's an online pharmacy group that you work with. Again, they have people that will help you. One of the things is let's look for other options. Maybe a drug is going to cost you copay or $80 a month, or you've got to pay for yourself and it's $400. Really ask them, what are the alternatives? What are the generics? And what would they suggest? What help would they suggest? I've done this quite a bit. Whenever my health insurance actually resets, even with the same company, I go through this again with them every drug and say, what are my options? What are my options? What are my options? And also look for drug manufacturer and third-party coupons, like GoodRx, third-party coupons. There are a lot of other groups, but that's probably the largest and most well-known. Many manufacturers, so I started taking a heart medication, and it was $80 a month copay out of pocket. The manufacturer actually had a program for the first 12 months of taking the drug. They would cover your copay, so it was zero copay on it. Again, that's a $900,000 help there. And again, look into also mail order 90-day supplies as an option to potentially lower your cost on a per pill basis. Next slide. Jody?
So one of the things we're all dealing with now is telemedicine and telehealth, which is exciting in many ways because a lot of times we can see our doctor if it's not something major, or they don't have to listen to our heart, or we don't need labs. We can see our doctor on our phone actually, or online in some way, or have a telephone appointment with our docs. And that's great. But we just really have to find out what that means for insurance. And I think a lot of, because it's so new, it's not that new, but the usage of it since COVID has been just astronomical. And so there have been some bills in Congress that deal with telehealth and telemedicine, and some standards that patient advocacy organizations have put forth for telehealth and telemedicine. But you really got to understand what that means insurance wise. So you want to make sure the visit is covered, the telehealth visit is covered. So I think that it is always a good idea if your provider says, hey, we're going to do this telehealth visit, and you can say, how is this covered with my insurance? And then I ask your insurance too, because that is something you want to know from your insurance provider as well as your healthcare provider. I never take the word anymore of one person. I ask two people. The other thing that seems odd lately is you could have more than one visit for the same issue. And so you need to know how that's going to be billed. For example, recently I had an issue with my blood pressure actually. And so they wanted to do a telehealth visit because of COVID. And I said, okay, fine. I bought a blood pressure cuff. I was had all that stuff at home. And so they did a telehealth visit with me, but then now they want to see me in the office. So how is that billed? Like normally I would come in the office, it would have been one visit, and now it's two visits. So you have to consider that when you're doing telehealth visiting. Also, again, with the telehealth, you want to review that explanation of benefits and make sure you know how it was covered, and make sure it was covered correctly, and contact your insurance company with any questions. And again, understanding the laws around telehealth. So each state has its own insurance laws, and they will have laws and regulations around telehealth as well at this point. And so you want to make sure that you know what the deal is in your state, because again, every state's going to be different, and there are some things that happen at the federal level with insurance, but most of the things insurance is run on a state level, state by state. So again, I always say appeal if necessary, because you want to make sure that everything is covered and everything is covered adequately, because you don't want to be stuck with a bunch of medical bills that you shouldn't have to pay. So check that out, check your bill out carefully, check your explanation of benefits out, and then make sure that everything is correct. And if not, then go ahead and file an appeal for it.
Thanks. Takeaway tips from tonight's webinar. There are a lot, and we look forward to answering your questions. But a few things, to think away or takeaway tips are, again, call ahead to your insurance company. Know what's covered. I think both Jody and I hit that several times. Stay organized. Again, it's not easy. If you have a family member that is more organized or likes doing things like this, get them involved. Again, don't panic when insurance denies claims. It happens all the time. I don't know what percentage it is on average, but many times these issues will get resolved. Remember to be your own best advocate. And again, use all resources available to help navigate the system. We'll be sending you links after the webinar, but certainly Google search whatever information you have and search and find, and hopefully you'll get the information and the help that you need. Jan?
Excellent, Greg. Thank you so much. And thank you to Jody. And behind the scenes, we have Heather Musgrove working the technology behind the scenes with us tonight. We have a few questions that have come in. So if we could kind of queue everybody up on the screen here, and we'll kind of go round robin and see who wants to take these. Robin asked, is there a resource for pharmaceutical or foundations or nonprofits who can assist with insurance funding shortfalls?
Jody, you want to try that one or? Yeah, so what I found is that depends on what state you're in. A lot of times, like one of the things that happened to us is we did have insurance shortfall, significant insurance shortfall. By the time we got home from the second surgery, we had $100,000 in out-of-pocket medical costs. So, and that was because of balance billing and different things. But if I lived in Pennsylvania, there were resources available for me, and in Virginia there were not. So in Virginia, they basically said, too bad, insurance companies, have the floor here in Virginia at that time. That was in 2003. But I would look in your state and see if there's something. The best contact person is, if you have a hospital procedure, is a social worker at the hospital, because they will know what resources are available to patients. That's the best place to look. They also have, the Adult Congenital Heart Association, is saying, has resources on their site. They also have the State Department of Health, I think, for each state. Sometimes you can look on their site and they have a bunch of different resources, health related resources. So I would look into that as well. And sometimes you just have to find, like I asked my pediatrician when we couldn't afford that one injection, and they knew of a private foundation that was giving grants to help with some of those costs. And we did get $600 up to $1,400 a month from that. So those are all the places you can look. But ask your doc, your social worker, your hospital, Department of Health.
That's great. Jody, thank you.
And real quick, one thing we didn't hit probably hard enough is really state and federal agencies, especially state agencies. I don't think we hit that well enough. Jody mentioned it, but that tends to be a really good resource, and you can find those groups pretty easily online through a Google search. So.
Yeah, and Kathy just said in chat, some cardiology offices also have social workers who can help you with that. So thank you, Kathy.
Excellent. Next question, Mott has a question. If you're not, this is a great question. If you're not the type of person who likes arguing with people about bills, do either of you have experience using any third-party companies who will do the arguing for you on medical bills? If so, what are the pros and cons of using a service like this?
I have never used, well, it's interesting where recently I haven't used it. Again, I like to argue and fight, and everybody that knows me knows that, and I gain great pleasure. So it's not something that I would use that much, but we did actually have, when we got insurance through a broker, my last plan, it was a fairly large insurance company that had a big health insurance department. And they actually had an advocate there that was purely your advocate. And they would go in and advocate for you to the health insurance company on your behalf. And they had a little more power because they would represent a number of group plans, large group plans. So they're not just talking about one person, they're representing potentially 50,000 people. And that seemed to carry a little more weight. So in that situation, I didn't even, go to the health insurance company till after they had figured things out, which 80% of the time we got a better deal and figured things out. Jody, what's your take on that?
So I'm so the opposite of that. Even though I'm a recovering attorney as a background, I do not like arguing about anything like medical bills or anything. So I, like you, do not enjoy that. One of the things that we used was actually through our insurance company, which was, I think it was Anthem or Blue Cross. It was a Blue Cross plan, and they had a I think it was called a care coordinator or a case coordinator. And because our situation was so crazy, like we had so many bills and so many different things, and I think you can request that even through your insurance company in cases where you have a procedure and you have a lot of stuff going on, a lot of moving parts, and you can get them to work with you to get everything situated with your coverage. And they actually really were helpful because we would look through everything, we'd talk to them, we'd say, hey, what about this? And they would go back to the insurance company. Like, we didn't have to go through that formal appeals process for a lot of it because the case coordinator was the one who went back to the insurance company and handled it for us. I know when you're getting insurance, also when you're looking at insurance plans, there are also patient navigators through the Affordable Care Act. And I don't think they deal with the billing end of it. I think they help you find the best plan for you and help you understand your coverage. So I don't think that would be the same thing. And then when you really get in a jam, I mean, I'm a recovering attorney, but there are attorney groups who help with that kind of thing, would help with medical billing. A lot of people don't realize, but medical the number one cause of bankruptcy is medical. And so there are a lot of people who are set up to help patients navigate the system and get the medical bills into some sort of reasonable situation.
Okay, great. Thanks to you both. That's very helpful. Brian has a question. What do I do if a procedure was coded wrong?
So we had this a lot. And one of the things we just told our doc, we were like, look, this should have been covered. Why isn't this covered? And they figured out it was a coding issue and fixed it. And so we did have to go to the doc and say, look, that we don't understand why this procedure isn't covered. Isn't this part of the routine care? and they're like, oh, and they figured it out and fixed the coding. Because you can't know, I think we're on ICD-10 coding or something like that now. Patients can't understand that. We don't know the coding, but you can find out why something wasn't covered, and it could be a coding issue, and they'll fix it.
And probably, it's probably a similar answer, but on the insurance end of things, Emily said, part of my treatment was denied insurance coverage. What should I do? So I'm assuming, you know, obviously you start with the insurance company, right? How would you handle that?
You know, I'll take it. I think one of the things is you go to the insurance company and understand why. Why was it denied? And if you know your policy well and your plan well, you will, you know, have a good sense of whether they're even close to correct or not. And then I would go back to my medical provider and say, hey, this was denied. How can you help me? You know, I don't have the money to pay it. And hopefully the medical provider can recode something, as Jody just said, or classify it differently, you know, to work with you on that, or again, negotiate the price with the medical provider if the health insurance company, you know, after many appeals doesn't finally pay for it. Jody?
You know, and I hate to say this, but a lot of times in the fine print of your policy is why it's denied, and some things will be denied. And that's why when you get coverage, like if you have like for me with a child with a serious illness, or with Greg or something, when you are getting coverage, like don't even get the silver plans or anything like that. You need the top plan you can afford, because they're going to cover many more things than the lower quality plans. And some people buy into plans like, again, there are associated health plans, or we call them junk plans in the patient advocacy space, where they look like they're really inexpensive, they look really good, and then you find out they don't cover anything, and that was in the plan. So go do your due diligence, like Greg said, go everywhere you can to try to figure out why exactly what Greg said. Why exactly is it denied? Where in the policy does it say this? And then keep going until you can really understand it. And then it may be denied. I hate to tell you, but sometimes it is denied.
Actually, we have feedback as well from one of our DCM board members, Dr. Chris Bell. And she says, sometimes the medical provider will need to talk to a person from the insurance company to explain why a procedure or test is appropriate for the patient. So getting the doc and the insurance company to talk directly. And then we have some comments about that this topic is rarely addressed, and they're very thankful that we're covering this tonight. Some cardiology practices may also have specific social workers who can help identify resources. So that's all very helpful.
One of the things I would like to add to what Dr. Crispell said is that, like, when there's a newer procedure, like I knew when there's a valve procedure would be a cardiac cath instead of surgery. The Melody valve first came out, like it was the kind of the first of its kind in terms of not needing open heart surgery to replace your valve. And a lot of times they would deny because this is a newer procedure. But exactly like that. If you can find someone, a hospital or doc, where they will accept it and cover it, or just keep going, get the doc to talk to the insurance company about why this is such an important procedure for the person to have. We had one of a young woman in our Mendable Hearts group who, she was an adult and she needed that procedure, and that's how she got it covered.
Okay, excellent, great. I think we have just a quick minute here. There was a question that came in this week in advance of this webinar, and I'll just quickly run through. If it's helpful for anyone, I'll run through the question and some answers that we had teed up for this. This woman says, I have 4 children that all carry the Titin mutation and an additional variant. 3 are boys with cardiomyopathies. 2 have implanted loop recorders. The 2 older have started college, and they'll be under our insurance until they're 26. How can young adults find health insurance to cover the cost of medical care? And can a family purchase an AED? And they're basically, many colleges and universities also offer health insurance now for students, for undergraduate as well as graduate. So that might also be a consideration when looking at schools. It looks as though her older 2 might want to go on to graduate school to pursue advanced degrees, she said. It's probably a good thing to add into the mix and the consideration where to go to school based on what kind of student insurance they offer. So that could be a critical aspect of that. Also, obviously, look at healthcare.gov. There's a number of resources. We'll provide some links in just a minute here. Turning 26 years old also triggers a special enrollment period for 120 days. So it's 60 days before and 60 days after the young adult turns 26. So that's something to be aware of when they can, when they age out of a parent's plan and they can enroll in their own plan during that time period. And as far as AEDs, there are grants available for AEDs, not just for organizations, but for individuals sometimes as well. And you can go to aedgrant.com and check out the resources there. So thank you so much for the questions and answers this evening. Let's move on to the next slide, which provides some resource links for everyone. And again, these will also be sent out after tonight's webinar in the roll-up with the webinar recording and so forth. We have advocacy group links, easy for me to say. And that's great because someone else had indicated Needy Meds. It was Amber had mentioned needymeds.com as well. So that's great, or .org. Health insurance help. Healthcare.gov, it has a huge amount of resources there. You just kind of have to dig through, search for what you're looking for. Sometimes you'll come across information that you didn't realize you needed to know, but they have this whole appeal insurance company decisions section. So that's another area to look. Getting the best RX price, again, at needymeds.org/drug pricing. And dealing with medical bills. If you start Googling, you can find all kinds of resources, but we will provide additional links after this webinar. And we have a navigating insurance guide that Jody was so kind to put together for us. It comes out of the Mended Hearts organization. And that guide is in a link on our website as well, on the dcmfoundation.org. And if you go to our resources section, you will find the Staying in Care resource links there. So if we can go on to the next slide. Again, we just want to thank our partner, Mended Hearts. Jody, can't thank you enough. We couldn't do this without you. Thank you to Greg again for making it all happen from wherever you are. Doesn't matter. Next time he'll come to us from Antarctica. No, probably not. No, we're very thankful for the partnership. So thank you, Jody. And thank you to Heather behind the scenes again tonight. Next slide. And we just would like to let you know that our next webinar will be held May 19th. And again, Heather, can you move to the next slide there? There we go. Thank you. And that's DCM Issues Unique to Women. This is a really incredible story of survival and hope. I have only seen the slides in advance of this, and I am dumbfounded at this story. So I really encourage you to join us May 19th at 6 p.m. Eastern Time. We'll send out the links and additional information tomorrow. And again, if you'd like more information about DCM Foundation, or if you want to reach out to us about Mended Hearts, just let us know. You can always email us at info@dcmfoundation.org and follow us on social media. So thank you all. I hope you have a great evening. Greg, be well, get well. And we'll see you next month. Thank you so much, everybody. Take care. Have a great night.
Thanks
Thank
everyone
you
for
all.
attending. Thanks, Jody. Thanks, Jan. Thanks, Heather.
Thank you, Greg. Thank you.
Take care now. Have a good night. Bye-bye.
Bye.